Your teeth can show trouble before the rest of your body complains, and the sign I take most seriously is not the obvious dark stain. Mild color change is often the lowest risk clue. Worn edges, enamel thinning, cracks, and cold sensitivity move higher. But one change people call normal aging can be the first visible hint that something is still active. Stay with me. The final sign matters most because it is easy to miss until damage has already spread. By visible tooth changes, I mean what you notice without an X-ray. One tooth looking darker, front edges getting flat, tiny surface lines, a sharp zing from ice water, or tips that look thin and almost see-through. We'll move from the usually less worrying clues to the ones that need faster attention. Color can be just staining. Wear may reveal pressure. Cracks and sensitivity raise the stakes because pain changes the story. But keep this in mind. The most important sign is quieter than a chip, and it usually shows up as a pattern. Start with color, because it is often the least alarming. Yellowing after coffee, a brown line near the gum, darker edges after years of tea or smoking, those can sit on the surface. Plaque can hold stain too, so a tooth may look worse than it is. And as enamel thins with age, the warmer layer underneath can make teeth look more yellow without meaning danger. The exception is a sudden change, one tooth turning darker than the others, color shifting after a hit, or discoloration with swelling, bad taste, pain, or cold sensitivity that lingers. Then it is no longer just shade, it is timing plus symptoms. Color is the easy clue. The next one shows what your teeth have been forced to survive. This is where I look harder. Wear has direction. If your front teeth look shorter or the small points on your canines are disappearing, grinding or clenching may be part of the picture. People often say they do not grind, then mention waking with jaw tightness, temple headaches, or a chipped filling they cannot explain. Enamel loss is different because enamel does not grow back. Teeth that look glassy, thin at the edges, or more yellow from underneath can fit repeated acid exposure, hard brushing, or constant sipping on acidic drinks. Not a diagnosis, a pattern. And once the shape of the tooth starts changing, you are no longer just watching color, you are watching structure. A tiny enamel line can look like a scratch on glass. Sometimes that is all it is. But cracks and sensitivity deserve more respect because they often speak before major pain arrives. If floss catches in the same spot, or popcorn always wedges between the same two teeth, the surface may no longer be smooth. That gives bacteria a place to hide. The mistake is waiting for constant pain. Cold water hits one tooth and makes you freeze for 2 seconds. Sweet food stings. Brushing near the gum line suddenly feels sharp. That can come from gum recession or enamel loss, but it can also mean the tooth is under stress. Pain when you bite and then release, especially on one side, is more concerning. That can suggest movement around a crack. Now the clue gets less dramatic and more important. Most explanations are local. Coffee stain, clenching, an old filling, a hard bite, a tiny fracture. Often, that is exactly what it is. But in the chair, I am not just staring at one tooth. I am asking whether the changes match a bigger pattern. One darker spot may be simple. One sharp edge may be a chip. One sensitive tooth may have exposed root. But several changes appearing together, or moving faster than expected, changes my level of concern. Not panic, concern. The key is progression. Are the teeth getting thinner, shorter, smoother, or more sensitive over months rather than years? That question leads to the sign I do not brush off. The most concerning visible tooth sign is rapid, widespread enamel erosion. Teeth start looking smooth and glassy. Edges turn see-through. Yellow shows through more strongly. Small, scooped-out areas appear on several teeth, not just one. A coffee stain is common. A worn, biting edge may be grinding. A crack after biting a kernel can be local, but thinning across multiple teeth is different. In some people, chronic acid exposure may be involved. Reflux reaching the mouth at night, repeated vomiting, severe dry mouth, or habits that bathe the teeth in acid again and again. The tooth may not be the root problem. It may be where the body leaves the mark. Speed is what raises concern. If last year's photos show thicker, whiter edges, and now cold water stings while teeth look shorter or more transparent, do not guess. Get it checked properly. Use this order. Mild yellowing after coffee or wine. Improve cleaning. Watch the pattern. Do not panic. Edges getting flatter, jaw tight in the morning, or fillings chipping without a clear reason. Book a dental visit before more enamel is lost. A crack with cold pain, bite and release pain, or food catching in the same spot. Get a prompt exam. And if changes are spreading across several teeth, thinner, shorter, smoother, more see-through, a dentist should be involved, and in some cases a medical check-in may be appropriate too. Safest rule: never ignore the change that keeps progressing. Save this before you forget the order. And if someone says their teeth are suddenly thinner, more sensitive, or changing across several teeth, send them this.